We all get sick from time to time, but there are some diseases out there that you really don't ever want to catch. And counting down from 8 to 1, here are the worst disorders in human history. Number 8. Cotard Syndrome. We all like a good zombie movie, probably because most of us realize it's not real. But imagine being convinced you were a zombie in real life. And you know what? This is actually a thing. It's called Cotard Syndrome, a.k.a. walking corpse disease, although it might not be quite what you're thinking of, because this disorder doesn't involve ambling about with a pasty face and a glazed look in your eyes trying to bite people. No, it's much worse. Mild cases are characterized by feelings of despair and self-loathing, and if that's a mild case, you're probably starting to get an idea of what a severe case must be. People at the more extreme end of the scale believe they are dead, that their bodies are rotting, that their organs are missing, or that they don't even exist. Yeah, nice. One sufferer was convinced her body parts had disappeared, which must be weird enough. But she also thought she didn't need to eat and was incapable of dying because she'd been condemned to walk the earth forever like the actual living dead. As the condition progresses, sufferers experience increasingly intense and often morbid delusions along with chronic depression. In another case, a man believed he was already dead, so he just stopped eating because he thought there was no longer any point. "You need to eat, dear." "I'm already dead. What's the point?" Although the condition is rare, apparently giving up eating is a common reaction to it, and as a result, sufferers often end up simply starving themselves to death. Number 7. Clinical lycanthropy. So there's a condition that makes you think you're a zombie, and guess what? There's one that makes you think you're a werewolf too. Lycanthropy is the term for having the ability to transform yourself into a wolf, but unless you're a character in a werewolf novel or a TV series, that can't actually happen. But if you have clinical lycanthropy, it means you believe you have this ability and think you're in the process of turning into a wolf or have previously done so. People with this condition can act like wolves, growling, howling, or crawling around on all fours, and they are sometimes discovered doing this in the forest. Others report distinct memories of having lived as a wolf in the past. In one extreme case, a 19-year-old boy who believed he was half man, half wolf, killed 2 people and was discovered by police sitting on top of one of them, growling and gnawing at the victim's face. Later, he told doctors at a medical center that he had eaten something bad, and when they were asked what it was, his reply was chilling. Humans. Humans. The condition is not restricted to believing you're a wolf either, although if other animals are involved, it's technically known as zoanthropy. In the past, people have also believed they were dogs, frogs, horses, cows, tigers, or snakes. Not quite sure what you would do if you thought you were a frog, though. Maybe sit by the side of a pond trying to catch flies in your mouth? Number 6. Ekbom Syndrome. If you're afraid of bugs, you'd better pray you never suffer from Ekbom Syndrome, also known as delusional parasitosis, because in this condition, people experience a delusion that their bodies are infested by imaginary parasites, insects, or bacteria. They may seek medical help, but when a doctor tells them they can't find any bugs, the sufferer can take matters into their own hands, scratching vigorously at their skin until it comes off, or trying to use harsh cleaning products on themselves to remove the bugs, harming themselves that way. "I'm covered in bugs! Get them off, doc!" "But there's nothing there." "Get them off me! Get them off me! Get them off me!" Often people with this disorder falsely interpret signs such as a small spot or scratch on their body, or a tiny tear in their clothes as evidence of the infestation. And then, nothing can persuade them that the bugs that are tormenting them are only in their minds. Number 5. Trimethylaminuria. Trimethylaminuria is a disorder you don't want if you enjoy having a social life, and its common name will help you guess why. This disease is better known as fish odor syndrome, and that's a pretty accurate description of what it does. It's caused by a metabolic disorder that means the body is unable to convert trimethylamine into trimethylamine oxide, but who cares about that? Well, trimethylamine smells of fish, so if you have this condition, you end up smelling like a fishmonger who hasn't had a shower in a week. In milder cases, the condition only makes itself known through fishy-smelling urine, but in more severe cases, people's sweat starts to reek like a fish market on a hot day. And imagine how that would affect your life. For a start, you'd need to ensure you never went on a first date anywhere without powerful air conditioning. And when you go outside, you might find yourself being followed by all the neighborhood's stray cats. You'd probably never want to go to the gym again either, because once you started working out, everyone else would start wondering why the gym smelled like the sea. But on the other hand, that could be a good thing because you'd never have to wait to get to the machines during peak hours, so maybe that's some small consolation. Number 4. Auto-Brewery Syndrome. Here's one that might sound kinda quirky and cool at first, but that's until you think things through. And then you'll realize it's another condition you really don't want. The name of this disorder gives you a clue as to what it's about. It's a condition where your body starts producing alcohol in your gut. And yes, it has much the same effect as drinking alcoholic beverages. But don't imagine it's like being able to have a crafty beer whenever you want for free without anyone noticing, because that's really not what this is. People with auto-brewery syndrome can unexpectedly experience elevated blood alcohol levels and basically display all the signs of someone who's drunk. This means you might be at your desk at work or in a meeting when you suddenly start feeling tipsy and unable to do your job properly. And it can also put you over the legal alcohol limit for driving. And of course, because it sounds like a totally ridiculous made-up condition, people are not going to believe you for a second when you try to tell them you're drunk because your body makes its own booze. I have this condition where my gut produces alcohol. You're fired. My body produces alcohol by itself. Fortunately, treatments are available, so once you sober up and shake off any remnants of the most unfair hangover ever, you can hopefully get back to living a normal life. Although it's rare, it's something anyone can develop rather than it being something you have from birth, so everyone is potentially at risk. So yeah, while having a miniature brewery in your stomach might sound fun at first, it's seriously not. Especially when you don't get to choose the hours when the brewery is in operation. Number 3. CIP and Urbach-Wiethe disease. These two conditions are different, but they're also kind of similar, so we'll do them together. CIP stands for congenital insensitivity to pain, and it does exactly what it says on the tin. Sufferers from this condition simply don't feel pain. Urbach-Wiethe disease, on the other hand, is the inability to feel fear. And your immediate response to either of these conditions might be, wow, I wouldn't mind a bit of that, until you start thinking about the consequences. The thing is, as unpleasant as pain and fear might be, they're both there for a reason. And that's to stop us doing stuff that might be dangerous or, well, basically, seriously reduce the amount of time we get to spend on Earth. For example, kids are taught by their parents from a young age that touching hot or sharp things is a bad idea. And usually these lessons are reinforced when the child touches something hot or sharp and realizes why they shouldn't do it. Same thing for banging your head on tables, falling off chairs when you're tiny, or anything else in this kind of category. But without pain, you'd have a hard time learning not to do these things. Same goes with fear. Big, snarling, drooling Rottweilers are generally best left alone. But without fear, it might seem like a good idea to go and poke one with a stick. See where that gets you. Or the fear of heights. This is apparently one of the few fears most of us have from when we're first born, and for good reason. We instinctively know to avoid things like the edges of cliffs, and if you need a second chance to learn this lesson, it probably means you're not going to get a second chance. So yeah, being fearless and impervious to pain might sound good if you're Superman, but for the rest of us, they're kind of there to keep us alive. So be careful what you wish for. Number 2, progeria. Here's the disorder that, as well as being a horrible thing to suffer from, it's also pretty freaky too. Because progeria is a condition that causes people to appear to age much faster than normal. Perhaps some kids out there might think that's not so bad, especially if it means you can buy vapes or get into bars underage. But let's be clear, that would be no kind of payoff for everything else you would suffer if you had this disorder. The condition is present at birth, and at first everything seems normal, but signs soon begin to appear that all is not well. Babies fail to grow or develop normally, and they soon develop a small face and jaw as well as a pinched nose. As they grow older, children develop wrinkly skin, making them appear much older than they really are, and other common features include a large head relative to the size of the body, hair loss, and bulging eyes. Although some people with progeria have lived longer, the life expectancy with this condition is only about 15. So yeah, if you have this, you're likely to be dead before you're even interested in going to bars underage. Number 1, Trimethylaminuria syndrome. The technical name for this disease is epidermodysplasia verruciformis, but let's just stick with the common name because it's a lot easier to say. Trimethylaminuria syndrome. It's characterized by tough, warty lesions on the skin, and if you've ever seen a photo of someone with this rare condition, you'll know how horrifying it can be. At first, sufferers start to develop spots and lumps on their skin, and this is unpleasant enough, but in more severe cases, things can get much worse. You know when you leave a potato too long and shoots start growing out of it? Well, in some patients, things that look just like that then start growing out of places like their face and neck. But even that's not as bad as what happens next, because as the growths begin to merge, skin starts to take on the appearance of becoming covered in bark, and people start to look like they're turning into a tree, hence the name. Eventually, in the most severe cases, the feet become completely covered over by warty growths that look just like roots and bark, and people lose the use of their hands and fingers as the tree-like growth swallows them up and fuses them together as if they were branches. The condition is thought to be genetic, and there is no known cure. Thankfully, the disease is extremely rare, but knowing that isn't going to provide much relief for anyone unfortunate enough to have it. Hopefully, you don't have any of these disorders and never will. And if you don't, show how grateful you are by giving us a like and a subscribe. See you next time.